This goes on and on. I'm telling you, go to the website and read this. She is phenomenal. Just going to say it right there. I'm going to hand the microphone over to her. Thank you so much for coming tonight.
Involved in absolutely everything, because we say he who holds the data makes the rules. And never doubt this. If you are in a society of surveillance, if you are part of Russia or China, it's all about having your data to find out what you're doing, who you're doing it with, and whether they approve it or not. So he who holds the data makes the rules, and when it comes to the healthcare system, that is true as well. And so you'll hear me say a little bit about that in this presentation, but really what I want to do now is tell you about the initiative that we have, which is being launched off the Wedge of Health Freedom. And that is to build a new system of health freedom across the country. So I think that, you start here with Houston, we have a problem. But I actually don't think that the majority of people understand what kind of problem that we have in this country when it comes to the healthcare system, or how it has been taken over by third parties, how outsiders control what doctors do. But COVID has given us some insights into this, as we see hospitals only willing to do a certain number of things for patients that the government has said are the right things to do, the things that'll be paid for, and nothing else can be done. But this problem of the outside control of the exam room, the outside control of the hospitals, the outside control of the doctors has been going on for a while. So now I just realize I need to coordinate with Jan here. So America, help is on the way. And help is on the way because we are serious about building the new system of health freedom in this country. Because one, we have a choice between socialized medicine, whether it's the corporate version, the health plans, or whether it's the full-on government version, where the government controls everything and every doctor is a government employee and every hospital is owned by the government. Or we can go back to freedom. And our organization has been around for about, I've been doing this for about 27 years. I'm a nurse by training, but when I saw that the Clintons wanted to take over the healthcare system, give us all a corporate version of socialism called an HMO, which is now known as a health plan, that was when I just said, if they take over healthcare, they'll take over the country. And that was the beginning of our organization and God's decision to set me on this path, even though I had a lot of people who said, this is going to be impossible for you. But here I am, 27 years later, and I have a staff, and we have an office, and we have a national perspective, not only just a Minnesota perspective, we work there too, but we're also starting to help legislators in other states with legislation that will help bring freedom back to different states. So Houston, we have a problem, and America Help is on the way. You can go to next. So this is me, and this is the way you can contact me if you wish, and that information will be at the end as well. Next. So I just want to give you a little bit of history before I talk about how we're going to build the new system, because I think understanding this is really critically important. In the 1940s, Congress decided to have wage and price controls. And so employers wanted to compete for employees, and they said, well, can we offer something called health insurance? And about 12 years later, Congress codified that. They put it actually into federal law. And that really created a captive, as you can see it now, most employees only have one option of insurance, right? It used to be, it was like anything, tons of options, but now it's really only one because you're all a captive group if you've got that. So that was really the beginning of socializing medicine in America. Then Medicare and Medicaid came, and then the HMO Act of 1973. The HMO Act of 1973 was Ted Kennedy's way of bringing you all into socialized medicine by the corporate version. So he merged the delivery and the financing of care into one thing called an HMO, and of course that's what socialized medicine is. It's the merger of the delivery and the financing of care into one entity, the government. But it wasn't that easy in America, so he needed to get a solution to get him to socialized medicine and single payer, which is where he wanted to go. He needed to get you used to being told no. He needed to have you put into the corporate version, and so what his bill did was it forced any employer with 25 or more employees to offer the HMO. And it gave $375 million to help spread the HMO across the country. Now the HMO today is known as the health plan. How many of you in a health plan? That's all that's in a health plan? In Kaiser, in Cigna, United Health. Okay, so Ted's mission has been accomplished. And you're all in a corporate socialism version of healthcare. So it's corporate socialism for healthcare. And then the HMOs, Medicare got put into the HMOs called Medicare Advantage. And that's growing by leaps and bounds. And then more recently, under President Obama, the American Recovery and Reinvestment Act, which forced everybody into electronic health records, and remember, he who holds the data makes the rules. That includes control over the doctors, profiling the patients, deciding what you can and cannot have. The High Tech Act is what was in the Recovery and Reinvestment Act. And High Tech stands for Health Information Technology for Economic and Clinical Health Act. And that was the way to force everybody to use the electronic health record that the government said had to be used. And it had to be used for the things the government called meaningful use. And if doctors don't use it meaningfully according to the government, then they lose money on every Medicare patient. All right, and then the Affordable Care Act, which said you all have to have a qualified health plan unless you get a health sharing, unless you do health sharing, or unless you don't make enough money and you can, and then be uninsured. And then the Accountable Care Organization is the last piece, and it's been called HMOs on steroids. So if you remember, Kennedy wanted HMOs. Well, the Affordable Care Act makes it HMOs on steroids. It really it makes the hospital into an entity that controls the doctors, and then if the hospital, this Accountable Care Organization, saves money for the government, even if that means by rationing your care, the hospital gets part of the savings. So it is essentially putting the doctors and the hospitals in a conflict of interest with the patient, which is not how it should be. Again, I'm a nurse. I'm a pediatric emergency room nurse, and I've taken care of lots of patients, and really it's all about caring for patients. And the hospital, the whole healthcare system has been turned on its head, and it's not really working for patients anymore. They have to have you, they have to have the doctors, they have to have the nurses, because otherwise there's no healthcare system. But their primary goal is not about you anymore. There's all sorts of other agendas in the healthcare system, including, I would say, your data. So your data is one of the most valuable things to the healthcare system. And just to give you one idea of how that is, United Health Group, which is the largest health plan in the world, they're even over in England, they have a data division, and it's called Optum Insights. All they do is data. And their revenue in 2017 was $8.1 billion. Wow. Your data is valuable. It's probably the most valuable thing that they have of you in the healthcare system. That's where they get it from. Okay, next. There you have it. So COVID. So, I'm going to use COVID here to just tell you what's been happening in the healthcare system over about the last 15 years as doctors have left their private practices because of the laws that I just went through. They can't handle the electronic health record. It's such an expensive, unfunded mandate, or there are different regulations in the Affordable Care Act that makes it difficult for them to survive. And so 70% of physicians today are employees, which means they're not working for you. They're working for the hospital, they're working for the health plan, they're working for the system. But they're not working for you per se. is because their bill is being paid by somebody else. So now we see this kind of full-blown in COVID, even though from my perspective as a nurse who's been watching this for a long time, I've watched this kind of control being foisted onto physicians. I've heard a lot of physicians talking about protocols, it's all protocols. That's because the protocols are put on the electronic health record, and they have a difficult time choosing anything that's not in the electronic health record because they can't order it. So if the hospital doesn't put certain things that the doctor knows would be good for you in the electronic health record, it's not there for the doctor even to choose. And if the doctor knows there's something that would be really good for you and actually pushes for it, it can be a black mark against them because, of course, everything is being tracked through the electronic health record. And again, I did write the book, Big Brother in the Exam Room, The Dangerous Truth About Electronic Health Records, to let people understand how the electronic health record is really controlling the doctor in the exam room and at the hospital bed. But COVID has opened the eyes because now we've really seen what this looks like. So outside control of doctors, restricted access to affordable, effective, life-saving drugs have angered a lot of Americans as they went to feed and seed stores to get the ivermectin that they knew would save their life. As people that I've talked to have eaten the horse version, apple flavored, and they have survived COVID and they've gotten immediately better. But they tried to get ivermectin from the doctors. And of course the doctors said no. And so loved ones have died, people have died because of the control of the exam room. Next. So here's from Dr. Joseph Mercola in Epoch Times, just talking about the hospital payments. Hospitals receive payments for testing every patient for COVID, every COVID diagnosis, and every COVID death, as well as any time they use remdesivir. It's about $3,000 that they get. And mechanical ventilation. It's about $40,000 that they get if they have a COVID patient that gets mechanically ventilated. If they have just a COVID patient that doesn't get mechanically ventilated, it's a little over $13,000, if I'm correct. So it's a big jump if they just put you on a ventilator, even for 2 hours. Suddenly the hospital gets $40,000. So there is a lot of incentives to call everybody a COVID patient, and I'm just going to remind you what the Illinois Department of Health, the head of the Illinois Department of Health said in a press conference when she was asked about, I think it was a teenager who had COVID. And the question from the reporters was something like, was it, or maybe it was a COVID death or a COVID whatever. The question was about saying, defining it. And what she said was, now you need to understand, if we have somebody that we have put in hospice, we know they're going to die in about 2 weeks, but we find out they have COVID. That's a COVID death. If we know somebody died of an alternate cause, but they have COVID, that's a COVID death. So if you understand even how the hospitals get more money for every diagnosis of COVID, you can see a little bit of how we don't actually even know what the real data is about how many COVID deaths there were, how many people died with COVID, how many people died from COVID. It's all very fuzzy. It wasn't keeping track of because there were other reasons that people didn't want to do that. Okay, so we look at a lot of COVID atrocities that have happened, and so life-saving early treatment was prohibited. Pharmacists have gone rogue and absolutely refused to give ivermectin even though they had it. Doctors are following these corporate no-care protocols. And one doctor say, when it comes to COVID, it's wait and see. And I thought, no, it's not. It's not wait and see. It's get early treatment. It's get aggressive treatment. And the doctors who are actually treating COVID patients will say, because I don't know the degree to which you understand long-haul COVID. It means you survived COVID, but maybe you're exhausted, you have to sleep 12 hours a day, maybe you still have brain fog, maybe you still have gut issues, maybe you have all sorts of things. There's a lot of people living with either post-COVID or long-haul COVID. They're not getting treated. They're like, I survived COVID, I don't need anything more. Nope, the spike protein is still actively engaged in your body, not infectious, but it's doing things, and there are things that can be done. But the doctors who actually treat COVID say, if you treat early and aggressively, you will not have long COVID. For the most part, you will not find a long COVID patient. because you have treated early and aggressively. But that is not what happened in this country, and that's not what our government encouraged, and that's not what the states encouraged, and that's not what the hospitals encouraged, and it was really all basically forbidden because the corporate entities control in line with the government and against the patients. So that whole thing about come back if you have trouble breathing, by that time you've entered the cytokine storm. For those who don't understand COVID, we do have a quick reference guide that we've created to help people through COVID, after COVID, everything COVID, in order to save people's lives. And there's a few copies up there, but there's also the version with the QR code, which you can just copy and then you can just download it through your phone, because I didn't bring a ton of them. So anyway, it's really important, with COVID, and we've just seen what has happened here. So now the drugs denied, the life denied. Here's from Harvey Reich, but it also comes from Dr. Peter McCullough. He has the same numbers. If the number of deaths that's been recorded of 700,000 Americans, so this was back in August of 2020, quite a while ago, is an accurate count, we could have saved 80 to 85% at least of those by early aggressive treatment.
That's right.
But the corporate and the government entities control the doctors. And this is a dangerous place for us as a country to be. And so more of the atrocities are dying alone, loved ones locked out, the elderly exposed and not protected, the clinics and hospitals shuttered while people had, cancer growing in their body. I know some people who ended up with the stage 3 or stage 4 because they couldn't get in. It was time for the biopsy, and the doors got shut, and they didn't get that biopsy for months. So there's a lot of non-COVID cancer deaths out there, and we're going to see more. Deadly care, the patient's intubated just to keep the air clean. Just to keep the air clean. And intubation is not what you think it is, and I speak here as a nurse. It's not just like you put a tube down and it's breathing for you. It causes all sorts of things that happen in your body. Fluid shifts, changes in enzymes and the mechanism of how it works. It's not without significant risk to intubate somebody. So 85 to 90% of intubated patients died, but as I said, there's more money. And then, of course, there have been people all around the country trying to get their loved ones out of intubation, out of the hospital, and into a facility that would actually take care of them. Some have been successful, like the family in Chicago who got a judge to say, yes, you have to give him ivermectin. And within 15 days, he left the hospital after having been intubated for a month. But others, like in Jacksonville, Florida, where Dan Pisano, his family was trying to get him out, and Mayo just fought left, right, and backwards to make sure that he never left the hospital. And was it for the $40,000? I don't know. But he died before his family could get him out of the hospital. More atrocities, fake data. The PCR tests up to 90% false positive, testing the healthy. The fake data died with or from presumed COVID instructions. The CDC said you should presume people are COVID, and just put it that way on the death certificate, so inflating rates. And then the discrimination, of course, that you all know has been happening against the unvaccinated or the uninjected would be the better choice there. Denied surgery, denied transplants, unwelcome in the clinics, harassed by physicians. I can't tell you how many people that I have that have told me that they went to the doctor for something, whatever it was, right? The only thing that happened at the doctor's office is a conversation about the fact that they had not agreed to be injected. They never got to the problem that the patient went there for, never answered any questions. Actually, one doctor started to cry in front of the patients. And so it's like the entire system is not there for the patient. And the patient isn't the one that's being taken care of. It is the corporate and the government mandates that are being taken care of, and this is a terrible situation for patients in this country and for the healthcare system in this country. So the next thing, COVID atrocities, tyranny. This interesting woman, I don't know how this physician, if you've ever listened to her, she really wanted everybody to be forced to be vaccinated and everybody forced to be masked, And so here you see her saying the unvaccinated should not be allowed to leave their homes. Well, now that's what's happening today, is the November pivot, all about the election, right? And suddenly she's all a fan of freedom, a fan of individual choice, a fan of people being able to make their own decisions about masks and vaccines. But her heart is still with, you don't have a choice, and you need to do whatever the government says. And the atrocities, again, with the injection and the mandates and the vaccine passports. And in case you didn't know, I just put this up here because it's really important to understand that there can be no emergency use authorization for these injections if there's an adequate, approved, and available alternative. Let's say ivermectin, hydroxychloroquine, fluvoxamine, right? All the protocols that are out there to actually give early and aggressive treatment, if that was allowed to be acknowledged by the government, there could be no emergency use authorizations for the injections, and there could be no mandates, there could be no passports. Just a few more atrocities, healthcare workers going from heroes to zeros, terminations, delicensures, job loss, doctors threatened with losing their license. They're calling it the Great Resignation. It's very interesting. The AMA now thinks that 20% of all doctors and nurses will leave in the next 2 years. Mind you, 10,000 baby boomers are entering Medicare every day and expecting to have a doctor to take care of them. There is this federal tracking of religious exemptions, and then I just list these three physicians here who Dr. Paul Merrick has sued his hospital for. He's one of the biggest, the most renowned ICU doctors in the country, if not the world. He's written 4 ICU textbooks that teach other people how to be ICU doctors. His death rate was 50% in the ICU. He was using ivermectin. The other places is about 80% of the people who die in the ICU. And the hospital said, no more ivermectin, no more hydroxychloroquine. And so he sued the hospital and they ousted him. Dr. Molly James terminated for ivermectin, and I think she also refused the injection. She has started her own COVID clinic called the James Clinic, which is telehealth. And then Dr. Mary Talley Bowden, she refused the vax. She resigned. She is now only seeing unvaccinated patients, and her staff is all unvaccinated. And she's in Houston, and she's suing her hospital in Houston to figure out all about the money, where they're getting the money from, how much money from whom. So she's trying, these doctors are trying to take care of patients, they're trying to save patients, and they've been told no. So patients are in trouble in this country. They've been in trouble for a while. It's just not perhaps as clear as what we have seen in COVID, because the protocols are in every electronic health record. The health plans and the government and the healthcare systems work together to decide what protocols are there, what's available. If you asked your doctors, and I would encourage you to do it, to just say, so what do you think about the protocols?
Yeah.
Do you like the protocols? On the computer, are there other treatments that you would prefer to give? Just kind of prod a little and see what they tell you, because most doctors are not happy about the protocols because they know there's better things that they can do for their patients. But they're told what to do, they're tracked, whether they follow them or not. So patients are no longer really the first priority in the healthcare system, and they don't know it. The mission of medicine's been taken over by the business of healthcare. Doctors are not in charge. Doctors are ethically challenged. Conscience violations are regularly occurring. Some of them are having trouble sleeping at night. In 2016, 48% of 17,200 doctors said they plan to leave in 3 years. And they are doing 60% of their time on reporting to their overseers and only about 30% of their time with patients. And as a reminder, they've spent at least 11 years of their life becoming a doctor to use their brain to help the patient live, thrive, and survive. And they find that they aren't able to do that. And so now non-doctors, legislators, have lots of bills to increase the scope of practice of non-physicians, whether that's PAs, nurse practitioners, And all of those people are skilled, but they have no medical training. They're not medical doctors. But this is sort of where a lot of legislators feel it has to go because the doctors are leaving, the Medicare patients are increasing. And so the next one is about physician exodus, just so you can, I guess I already talked about that, 70% employed. And so a lot of the non-physicians, because they don't have the medical training, if there's something else that might be better to do, they may not understand what that is. So they're a little bit more, I would say, controlled by the electronic health record. So whatever the electronic health record is, whatever the protocols are, that they are more likely to follow that because that is their training. They haven't had 11 years. They haven't had all of that training. They're good people. They're being put in a position of essentially taking the place of doctors in a variety of places. And so, but patients are also not really aware of this. So the next one gives you these 3 surveys. 2003, they plan to leave 5 years early. So a lot of doctors have already left. Some of you probably know them. 2016, 48, and 2022, 20% plan to leave. Okay, so the solution. Because our organization believes that a patient is a vulnerable person. The healthcare system is here to help the patients. Every patient needs to have a doctor, an advocate, the entire healthcare system in their camp, and not under control of corporate entities. And so we, as I said, are planning to build a new system of health freedom in this country. And it's going to perhaps sound a little amazing to you to think of the possibility of actually doing this. But the system that we want to build is the system that we used to have. This is not rocket science. The system that we want to build is the system that we used to have. So in 2016, we launched the Wedge of Health Freedom. And this is a system of clinics, or an online directory of clinics, and we just added our second pharmacy, that are all cash, check, or charge. No government payments, no insurance payments. It doesn't mean that you don't have insurance. What it means is your insurance pays you, and then you pay the bills. And this is exactly how it used to work. So we call it the Wedge because there are these kind of practices today, but they're really invisible. So you can see that kind of dotted line down there. And the Wedge is to make those practices visible today, to build the number of practices, and eventually have the entire healthcare system, cash, check, or charge, completely patient-centered, every price transparent, the doctor working only for the patient at an affordable price, not all those third parties with their fingers in the middle doing retroactive utilization review and prior authorization and mandating all the data collection that costs so much money. So here is how we have it at jointhewedge.com. You can find this diagram yourself. Today, the payer is on top, whether that's the government, the employer, the health plan, the patient and the doctor are in the bottom 2 corners, and the only one who knows what's going to happen with the data, the dollars, and the decisions are the payer on the top. And everybody else is just waiting to see. Are they going to get care? Are they going to have to go through step therapy, 4 different kinds of medications before they get to the medication the doctor knows works? Are they going to have to wait for a year to get prior authorization because the health plan says it's not medically necessary because you're not this age and you're only this age, right? Whatever it is, all the control is in the hands of the payer. And so we're going to disassemble that triangle, and the insurer will pay the patient, and the patient will pay the doctor and the hospital. Now, as I said, this is how it used to be. And actually, the last time I was in Cape Girardeau, there was an insurance agent in the audience who spoke up and said, well, that's how it used to be. So again, not rocket science, but it actually takes all the money and all the hands and all the government and all the controls out from between the patient and the doctor, making it affordable. And if you wonder how affordable it can be, you look no further than the Surgery Center of Oklahoma. How many have heard of the Surgery Center of Oklahoma? Okay, everybody needs to hear about the Surgery Center of Oklahoma. So it was started by Dr. Keith Smith and his partner. It's basically all cash check or charge. They're paper records, so they don't have the cost of all the digital records, the unfunded mandate. And their prices are 50 to 90% less than the hospital up the street. Sometimes even, even greater than that. So this is the way we can bring prices back to prices you don't hardly dream of today, but are actually possible. As soon as you take out all the other third parties that are in the way, they're making everything cost a lot of money. Okay, so here's our vision. Patient-centered care, affordable care, confidential care, a trusted patient-doctor relationship, real insurance. So real insurance. Real insurance is medical indemnity insurance. It's not a health plan. It's not an HMO. It's not prepaid care, which is what that HMO and health plan are. It's not managed care. It's an insurance policy that pays you. And how it usually works is that the insurance policy knows the general cost of the region for a service or a condition or whatever it is, and the hospital and the doctors also know what the insurance company is likely to pay. And then you, the patient, get paid, and sometimes if you can find a practitioner that is less, or you want to take your money and go to Mexico and get it done there and end up with keeping half of it, whatever it is. It's a different contractual relationship than we have today, but it's what there used to be. So non-interference by government or other third parties, cash-based pricing, transparent prices, and doctors are doctors. And the doctors who are taking care of COVID patients today will often just say, let doctors be doctors. They've been told they can't use ivermectin, they can't save their patients. They've never had this happen in their entire life, except for the controls that have been coming out of the hospitals, but never this kind of control where they know they can save lives and they weren't allowed to. Okay, the next one, the goal, independent cash-based private practices, clinics, hospitals, laboratories, radiology facilities, surgical centers, and eventually medical schools. You probably don't understand this, but the health plans are building medical schools so they can train their doctors to do the managed care way. So they can train their doctors to follow the corporate protocols. So Kaiser has their own medical school. There are some other medical schools being built that are training doctors to be managed care doctors, not doctors. And so it's been fun for me to watch some of the COVID care doctors talk about how there needs to be independent hospitals that are cash-based. And ever since we started the Wedge in 2016, I'm like, that's always where we gotta go. And then we can also bring back the hospitals that are, Catholic hospitals, Lutheran hospitals, right? Bring all of those back. And there should be charity in the healthcare system, but the government doesn't want charity. The health plans don't want charity. Charity is a critical piece because medicine has always been a mission. Taking out the charity and in exchange for Medicaid, which is coerced charity, right? Some of the doctors don't even get paid by Medicaid because the hospitals or the government or the corporate don't think it was actually worth the while for the care that they gave. So they gave care, but they eat the cost. All right, and the next one is the choices. As I said in the beginning, you can have socialized medicine, the corporate version, socialized medicine, the government version, or we can go back to freedom, which is independent, cash-based care in this country, how it was for years and years and years and years and years before we moved to health plans and away from real insurance. So now, just asking the question, what will you choose? You can go to the Wedge today and you can find practices. Now, I forgot to look up to see how many are in Missouri. There are also practices that are not yet on the Wedge that are like direct primary care or they're fee for service. They just don't know the Wedge exists. We're building the Wedge. We've got 350 some practices now around the country. There are many more to be added. But our goal is to go way further than that to build the new system. And the time seems to be right, particularly as a lot of nurses and doctors have been ousted. who refuse to follow the protocols, who refuse to get the vaccine, who suddenly realize that their hospital really doesn't care about them at all unless they will comply. So just a few things here about, is your doctor in the wedge? Tell your doctor about the wedge. Start to build a vision in your doctor's mind about getting out from under corporate and government control. Build a vision. This is just a map of some of the places where the practices are. The next thing is what we call wobble wedges. So this is our little gimmick, as it were. I don't think they're on the tables, right? Are they on the tables? Yeah. Oh, okay. So when you're at a restaurant and the table is wobbling, you can put a wobble wedge under the table. But know this, the healthcare system is wobbling, and so use the wedge. And we're going to build the wedge, and so into a system of health freedom to save patients, to keep the integrity of doctors, and to get healthcare back to where it needs to be. Now I'm going to finish by just saying a few more things about what our organization does so that you understand we're more than the wedge, and we're more than HIPAA, and we're more than COVID. So really quickly, I'm just going to go through this so you can see it. So we're all about protecting patients and doctor freedom. And the truth about HIPAA, a really big campaign for us because he who holds the data makes the rules. If you want to get third parties not to control the exam room, you got to take away their access to all of your data. So we are regularly engaged in trying to make that happen. The Patient Toolbox is a place for you to find out how to say no to the HIPAA forms. You can go at the clinic in the hospital, there's actual forms. We tell you what to look for, what are the weasel words, what are the things you should cross out. There's other things in there, having a baby, knowing that they're taking the DNA, some of the states, keeping it, how you can keep that from happening. And then we created an entire drawer in our toolbox for coronavirus, and we got our entire Face Freedom campaign there, our billboard campaign against the vaccine mandates, as well as our COVID guide. So here's our COVID guide. You can find it online. It's right on our homepage. It's got almost 100,000 downloads so far. People have said it has saved their life. COVID isn't as prevalent now, but it's probably going endemic, but people are still dying from COVID, and there's so many people who are living with COVID who think, well, yes, they did survive. That's not inaccurate. They did survive, but they're not done with COVID. And if you know anybody who says, I've got this COVID cough, or I'm sleeping 12 hours a day, or by the afternoon I'm experiencing brain fog, the spike protein is probably very engaged still in the body, and they should go to a COVID care doctor. And we have it at earlytreatmentoptions.org, how to find them, which is also in the reference. You can find out how to find those doctors. Go to telehealth, they're around the country, and they'll help you get actually really better. And then this is our early treatment kit, just everything you might want to have in one. Next is the model state legislation. We got a bill that we're trying to get everybody to pass, freedom to prescribe and dispense drugs for off-label purposes without retribution. And we want it to be retroactive to all the doctors who have either lost their license, been terminated, or whatever. We're trying to get that passed in a variety of states. And then next is just the book. So working on getting the third printing out. And then the last thing is just if you care to support our work, this would be one way to do it. And then you can follow us on social media. And the last thing I'm going to do, if you want to stay engaged with what we do, we have I have these signups, and we'd be happy to keep you in the loop what's happening at the national level. Like the Democrats they really want to create a unique patient identifier for all of us, a single national medical ID card. And we've stopped them for a lot of years, but they're all Democrats now in Congress. So we're working to stop it, and I'm not sure whether we'll be able to. And hopefully, if it turns Republican in January, there's, because we have Rand Paul on this, with us, we could likely stop it then. But so those are the sort of things at the national level, at the state level, and just health freedom in general, that if you wish to stay engaged with us, we will send you our every other week newsletter by email, and anything else that you wish. So thank you.
Will you entertain questions?
Yes.
Okay. Is that fabulous or what? Absolutely. We're gonna, we've got microphones stationed in the center of the room, the middle of the room, and the back of the room. Microphone employees, are you ready? Okay, so questions for Ms. Twila?
Ms. Twila? Ms. Twila, what can we do as regular folk to, what can we say to our doctors to,
Wake them up.
yeah, well, not necessarily
Make it
that, but
serious.
to stop what they're enforcing on us? What can we say, what are keywords we can use to keep them from enforcing this on us?
Yes, and so actually, I actually do in the book, I have questions to ask doctors. So here are some of them. So, get out your pens, because I think every doctor should be challenged just a little bit, right? So you can start with something that might be less of a challenge. Saying something like, do you feel free to make the best medical decision for me? And another one could be, I understand there are certain protocols in the electronic health record. If you don't follow them, what happens? And then another one could be, the treatment that you just prescribed for me, is that the best treatment for me or the only treatment you're allowed to give me? Because their conscience must be pricked. And then you can follow up with something like, wouldn't you like to be free to be the doctor you wanted to be? Have you thought about going free? Have you heard about the Wedge of health freedom? Have you thought about opening up your own practice where nobody controls your decisions? Pricking their conscience is a safety for you, but it's also really good to bring them back to what they know they're responsible to do.
I have a question.
Yeah.
So are these standing clinics, are they only in states that have abolished the certificate of need?
One more time?
No.
So even in states that have certificate of need, so you guys know we've talked about certificate of need here in Missouri. We have House Bill 1616, and we want that abolished. And believe it or not, there are several reps and senators who have been bought by the hospital lobbyists already and have said, no, we can't risk that. Oh yeah. And so, so my question to Ms. Brase was, are these standing clinics only in states who have abolished? And she said no.
No, they're not, because most certificate of need does not have to do with these kind of individual clinics. They might have to do with radiology facilities. They certainly have to do with hospitals. But most of them are not focused on individual practices.
Gotcha.
Jan, is EBOMD one of those clinics?
You met with him, didn't you?
No, I tried to meet with them. I sat in that office for a half an hour hoping I could talk to the owner and convince them to come onto the Wedge. But I never got in contact with the owner. But I will say this, so I just heard somebody say he's real liberal. We do not have the clinics on the Wedge or practices on the Wedge where there's no litmus test about liberal or conservative. If you want to have an go right ahead. One of the things that we tell people is practices on the Wedge may or may not want you to be vaccinated. They may or may not give you exemptions. We do not control that. What we're doing is building a system of freedom. Then you can find a doctor who meets your need and who has your philosophy. But if they're willing to go free, that's what we want. We want as many practices free, and then we want hospitals who are free. And just to give you a little hope about this, I've talked to several physicians in and outside of Minnesota. So, and they are thinking really seriously about buying a hospital. The Affordable Care Act, however, says physicians can't own hospitals. So, but that doesn't mean that somebody else who wants this to happen can't buy the hospital and put the physician in charge. So there are a variety of ways, and we're really serious about this movement to move into building a new system. And so that's like our biggest thing that we're doing in 2022, and it's probably going to go into 2023 because we are going to come up with all sorts of opposition. The big guys will never want this to happen. And if any of you were listening to Fawn Riggins yesterday, apparently she was getting a lot of grief for even talking to me. But you know, we have a vision of freedom, and we think it's very important to make it happen. Okay, next question.
That EBO place that you talked about, my doctor quit. He retired early because of the electronic medical records. And he works
there you
over there, so I'm kind of surprised that they weren't willing to talk to you. Can you hear me?
Well, yes, and the thing is that they wouldn't have to do the electronic health record, depending on how they have structured themselves. They lose money with every Medicare patient. If they're taking Medicare, they're not a Wedge practice.
No, they're cash-based practice, I think. I'm pretty sure because I called over there. EBO is.
They wouldn't have to do the electronic health record. That's their choice.
Well, I went to a hospital-based doctor. I got COVID. A year before I got COVID, I sent a letter to my doctor. What are you going to do to treat me when I get COVID? Because everybody's going to get COVID. He sent me back a big old detailed list from the hospital. He was a doctor in the hospital, at the hospital. When I got COVID, his nurse turned me away, told me to go to urgent care somewhere. I didn't get any treatment. I had treatment from out of state, which I secured before I got COVID, but I needed to get a chest x-ray, which I couldn't get. This was a big circle. So I got an independent doctor in town because, and the first thing I said was, are you going to treat me for COVID? And I want paperwork. Because I don't think that a lot of things won't change unless people leave the hospital system and you get them where it counts in the money, in your bank account.
Or you build a competing hospital system.
Yes.
I know you mentioned about 417 house calls at the last time you spoke in Cape. Is they part of this?
I cannot see whoever is talking. I do not know
Oh,
where
hey,
you are.
sorry. The last time you spoke here, you talked about the 417 house call doctors and are they part of the Wedge?
I do not know all of the doctors that are part of the Wedge, but you can look for them, and if they're not on there and you know they're cash-based, tell them.
Okay. Will do.
Yeah, one name that I think should be brought up in this whole thing is the godfather of this whole mess, and that's Anthony Fauci.
It was
Because he
before him.
controls all of the data, and he controls
I'm getting it. Yeah, it
all
was way
of the
before him.
research that's being, the doctors are being exposed to. It's the research that people are coming up with. I'm sorry, I didn't want to spit on the microphone. The research that are coming up with that are contra to his view of things and the drugs that he's working on, he uses big pharma to shut them down, and journals like Lancet and New England Journal of Medicine and all that won't publish their data. because they'll lose their advertising from Big Pharma. And so a lot of the physicians that I know just don't really understand the research that's behind ivermectin and the other drugs that can be used. All they know about is what Fauci wants them to know.
So that goes to the whole corporate control, and I think it was Dr. Molly James in a COVID summit who talked about figuring out, I don't remember how she figured out, or she read some article about ivermectin, she started considering it, she used it for her patients, she saw improvement, and then the hospital shut it down. And then they ousted her, and then of course she started the James Clinic, which is in Missouri, and it's telehealth, and she's an ICU doctor. And so she figured it out for however she figured it out, but if you're a corporate doctor, there is virtually no reason for you to figure out anything else because you are tied to the protocols. And if you aren't tied to the protocols, you might get, ousted from the hospital if you aren't doing what they say. So why fight the system, right? And of course, what we really want, and I think you probably maybe don't understand, and I didn't really say, but doctors have lost their joy. They've lost their joy, and we want to bring back the joy. Because so many of them just had so much joy taking care of patients, figuring out the problem, working with the family. This is what they gave all those years for, and now they've just become clerks, reporting data to their overseers. I am talking about protocols, and I know what you're saying about Dr. Fauci, but it has to do with COVID. But he is not the one who ultimately puts the protocols on there. It is the hospital system, probably in concert sometimes we think with the health plans, like the hospital says, will you pay us money for that? And they agree about what's going to be paid for or not. The government, Fauci can do certain things, but he can't do everything, and now he's definitely out of favor. He's doing all sorts of little interesting videos with very small little outfits, still trying to have some kind of influence on YouTube, but he's in disfavor. But he does not control all the protocols that have been happening across the country. But he certainly helped to get ivermectin going. But so did the FDA. So if you look at the COVID report, the COVID guide here, actually have an ivermectin chart in there. In August of 2021, ivermectin was like way up. It just like shot up. All these prescriptions. And the CDC tracks it. Again, he who holds the data makes the rules. And so the FDA came out with a tweet. What are y'all doing? It's for horses. Stop it, y'all. And that stopped a lot of the pharmacists from dispensing it and a lot of the doctors from providing it. And then, of course, that hurt patients and probably lost lives. So there's a concerted effort at the federal level.
I'm gonna go first. I've been holding this for a little bit. I have two questions for you, sorry. I don't want to forget.
Dibs, she's taking dibs.
So my first question, which I knew this and all, but for others who didn't know. Huh? Oh, I'm a nurse. You made the comment about the feds basically tracking all of us who put in for religious exemptions. Totally understand they're going to do something with it, but do you have an idea of?
No, I do not have an idea. There's like 25 different agencies tracking it. And it used to be something where it was completely forbidden for the federal government to track anybody's religion. And here, this is just the Biden administration deciding to go
Whatever,
yeah.
So is it something, I guess, that they made required by our employers? That, like, how are they getting it?
Yeah, that's a very good question. I do not know.
Okay.
It was something I hadn't yet gotten into figuring it out.
Okay, all right.
Yeah, sorry.
My other question, and maybe it's in your COVID guide, I've I've been educating patients. I'm at Landmark Hospital in Cape. We take, it's a long-term acute care hospital. We take vent patients and so forth. But anyway, so we get a lot of COVID patients that are dealing with the lung scarring basically and whatnot. And I know what COVID pneumonia is. It's not really pneumonia. Right, and that's what I'm explaining to them because they're like, why am I not getting better? We're doing all this stuff. And I'm like, okay, well, let me explain this to you what it really is. I was actually very happy I was able to explain that to a nursing student yesterday. Anyway, okay, so for those still having their lung issues, not being able to breathe well, still on oxygen and everything else, is there something in your COVID guide that maybe I can hint at them to try or to do when they get out of the hospital? I mean, obviously I can't prescribe stuff, but I'm just trying to help people the best way that I can.
Good for you.
Yes, so
Perfect.
I think you will find the guide very interesting because I quote a lot of the physicians, and in particular Dr. DeMello, who was from Minnesota but is now in India and has treated 12,000 COVID patients. Only 14 have died, all of them diabetic, and only 35 have been hospitalized. And so think of that, and then all of their families. And so I spent a lot of time talking about what he says about helping to get them back to normal. And colchicine is a really important drug to do that, and it's not really used here much. People don't really talk about it. Peter McCullough uses it, Tyson and Fareed use it, but not to the degree that Dr. DeMello uses it. And so I think you will find a lot of good information to help them move forward in clearing their lungs of the clots and the cytokine storm. And so I'll just say this for everybody who's here who doesn't really understand COVID. COVID is, it's not really a viral illness. It is a inflammatory and clotting disease. And so the virus is just the very beginning. You do not know if you're somebody who's just going to go back to normal after the viral part, or if your lungs are going to react to this cytokine storm, which is a field of viral debris as the virus breaks up, including with a spike, and then it hits your lungs. And then you get the cytokine storm, which is an overactive immune response. And this fluid comes between your alveoli, your air sacs, and your tiniest capillaries. And there's difficulty getting the oxygen and the carbon dioxide exchange. And then it doesn't take very long from the cytokine storm before the clotting begins. And once the clotting begins, as Dr. DeMello says, it's hard to stop. And it can be all around the body. So people who died have had clots in all their major organs, but you see it a lot in the lungs because immediately people start turning blue because the oxygen isn't being exchanged. So to understand, it's not really a viral disease. It is an inflammatory and clotting disease. You must stop the inflammation. You must stop the clotting. The virus, you can live through those little days where you're like, oh, no big deal. But then suddenly on day 8, boom, you're in trouble. You're in trouble. And so that's because you hit the cytokine storm and you were thinking it was just this viral disease. It's not just a viral disease. And so I would say, it's online. I have a few complete copies, which are really for people who don't have online access. So if you don't have online access, you don't have a computer at home, it's hard to imagine, but there really are people who don't. We have a few copies for that. The rest of you, these are the few copies. The rest of you could actually get it right downloaded from just that little QR code. Here, I've got a few copies there, but it's on our website. And I had one woman say, if I had read your COVID guide, if you'd had your COVID guide before this happened to my mom, she'd still be alive.
What was that drug you said? Coltrazine?
Colchicine.
How do you spell it?
Colchicine. CHICINE.
CHICINE.
INE. And
Coaches.
the report explains the mechanism and how it stops the inflammation and the clotting.
The other drug name, I guess you can say for it, is Colcrys, COLCRYS, I believe.
COL.
I've not heard
C
that one.
what? COL.
COLCRYS. I actually had my pericarditis in 2011, and colchicine is something that I ended up taking. I was getting recurrent, what they call recurrent intermittent pericarditis. So I was on colchicine for a while. Okay.
Okay, other questions?
Right here.
Hi, I'm also a nurse, and some of us would like to find our joy back as well. I've been a nurse for 34 years,
Yep.
and I've not seen the likes of what I've seen in the past 2 years.
Amen.
I've lost so many
Patients? Yeah.
because the doctor told them this was the best thing to do,
Yeah.
and I knew it wasn't.
Right.
And it's just so, when she was talking about, when she said, first, oh, you're the hero. You go from a hero to zero, just like that.
Yep.
The mandates. And it's a certain narrative that they want everybody to believe. And so some of us put in for exemptions, different things like that. And she said, well, what are they doing with the religious exemptions and how are they getting it? Well, there's more to this than that. This whole system of data collecting.
Right.
It's not just the healthcare. They want to know everything about you, and all the data is being collected, and where you stand religiously, and all of that. All of that is combined. And when you said earlier about, I think was it Fawn Riggins that kind of got a little, because you were here before.
She wasn't, but some of the people who were texting her, messaging her yesterday were basically not happy that I was giving
Yes.
this vision.
Right, okay, because the wedge is going to be pretty much a thorn in the side of the healthcare community. And I want to know that if this sets up, I think this is wonderful, but it won't succumb to the new ESG scores and
No.
standards that they're enforcing secretly now, where you have to start doing these things in order to be a part of the global digital system.
No, we are, no. 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 It promises confidentiality within the four walls of whatever the facility is. And we're, like I said, we're like the privacy people in the country when it comes to medical data, because he who holds the data makes the rules, and that should be you and your doctor. Amen. Yeah.
May I ask, we are anxiously awaiting your book.
Where?
Right here.
Anxiously awaiting your book.
I'm anxiously waiting it too. Yes, and so our hope is, and now it's a very interesting supply chain issues on paper. And so my hope is to do the last edit while I'm probably in the next week. But then I'm hoping that there will be paper too. It's sort of interesting, when we have done some of our mailings, our printer has said, okay, well, we got everything except that envelope, and that envelope can be found nowhere in the entire country. Really? Okay. So there are possibilities that could delay it, but we're really hoping to have it in September, October. Yeah. Yep. I know.
So if you refuse to sign their HIPAA stuff, what are they like? What are they? Do you just are they just stunned, shocked, looking at you?
Oh, yeah.
Like what are they? What do they? Can they refuse you service?
Yes, they can.
Sometimes.
Really? Did they do that to you?
No.
No, they didn't do that
No,
to you.
because this was
Because
about
you
8 years
put the
ago.
smack down on 'em?
And it got quite
You
interesting.
told them who you were, or doctors? Like seriously, like what do they do?
So they look at you like you're, the unicorn with two horns, and because they don't even understand why you would, and because they've been told that this is about your privacy, so why on earth wouldn't you sign it? But of course, all you're doing, so get this straight, everyone, whether you sign it or not, it doesn't change what they can do about your data. They can still share your data without your consent. This is all a deception to make sure that you think your privacy is protected. So, but if you actually look at the words, it says, I understand, or I've read, or I've received the notice of privacy practices. That's all you're signing.
Kind of makes you want to ask them for a copy of their driver's license to promise them you won't do anything with it later, right?
Right. And so,
Your social security number.
yeah, and so that's all you're doing. And some people are definitely denied access to care. I once left.
Is it more common for them to deny you care? Or is it more common for them to go, I don't understand this, but come on in?
Nope, it's more common for them to say, you have to sign that, because their attorneys tell them they could get in trouble with the federal government for not following HIPAA requirements. And so we do have an entire thing that you can look at to take things with you to the clinic. Yeah.
Okay, thank you.
My name is Tricia Wishman, and I'm a holistic health practitioner. I'd like to share with you all the name of the hospital in St. Louis that specializes with lung disorders. I have a dear friend and high school comrade that nearly died in one of the hospitals in Cape Girardeau. Was there for over 2 months and was on the ventilator and all through all that, and got to where he could not talk, could not walk, could not eat. And they finally got him off the ventilator, and this was given to him as an opportunity. It's called Kinder Care, Kinder, C-A-R-E. It's outside of Barnes Hospital in St. Louis. It only has 60 beds, but it specializes. And in less than 3 weeks, he was out of the hospital, and I have the privilege of working on him in 2 days. His story is phenomenal. He's 70 years old. He was a Vietnam vet. And by the way, this hospital is very acceptable to vets. So keep that in mind, and I can't wait to see Ron in a few days.